The other area of targeted medicine in non-small cell lung cancer is, of course, our small group of patients that have ALK gene rearrangements. And the treatment for this group of patients fundamentally changed with the development of Crizotinib. Crizotinib it was demonstrated to be better than second-line chemotherapy when we started using the drugs initially. And then more recently, Profile 1014 demonstrated that Crizotinib was better than first-line chemotherapy, and as a result of that, Crizotinib became the standard first-line treatment. And of course, we now test for ALK in all of our patients at diagnosis, because if they have an ALK gene rearrangement, then their preferred treatment option is with Crizotinib, an ALK inhibitor, rather than chemotherapy. What are the challenges for us with patients with ALK disease is similar to the situation with EGFR. So patients who are on an ALK inhibitor will eventually develop resistance to that ALK inhibitor, and we then have to look for other drugs that can overcome that resistance. So there's a number of next generation ALK inhibitors that are being developed, many of which we are now having results for, some of in the second and third line post Crizotinib, post other ALK treatment. And most recently, we've had a study presented of a head-to-head trial of Crizotinib, our standard treatment, versus one of the next generation ALK inhibitors, Alectinib. One of the big challenges that we have with patients with ALK disease is that many of these patients unfortunately develop spread of the cancer to the brain. And Crizotinib, although it does have activity in the brain, some of the newer generation of drugs have much better activity in the brain. And one of the key findings of the ALEX trial, which compared Alectinib to Crizotinib in a first-line study, was that not only did it improve progression-free survival, but in particular, it improved it in the brain. So it's of great importance to us because it's actually preventing patients who didn't have metastasis in the brain from getting them, and from those that already had disease on the brain at the start of entry into trial, their time until disease progression is longer on Alectinib as well. So it's a very important study, and that drug, that data is really hot off the press, came from ESMO 2 or 3 weeks ago, and will now be going through the regulatory processes. But it's a drug that is likely to change our first-line treatment for ALK patients in the future.